Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey Vet Rehabbers, it's 57 days until the Vet Rehab Summit. If you have not got your ticket and registered, you need to go to vetrehabsummit.com now. It's on the 10th and the 11th of November. It's our annual online veterinary rehabilitation conference. The whole thing is online. So you don't have to go anywhere. You can do it from the comfort of your home. Now, the theme this year is myofascial kinetic change. And we've got two lecturers, Vibke Elbron and Rika Schultz, and they are going to be sharing never before shared material from their research. It's going to be absolutely amazing, guys. Love to see you there. We've got different tickets. There is a free limited access pass. We've also got a full access tickets, as well as our VIP Onlinepethealth member tickets. Now, you'll get access for 30 days to the recordings after the event. Go to vetrehabsummit.com and register now, guys. You're not going to want to miss this one. A very quick thank you to Adelaide Chin from @ARC Veterinary Physiotherapy. Adelaide, thank you so much for your shout out about the Veterinary Rehabilitation Podcast on Instagram. If you're listening, please send me an email at meg@onlinepethealth.com. I'd love to gift you a limited edition Veterinary Rehabilitation Podcast mug. Now, I'm going to be honest, I had never ever heard about the topic that we're going to discuss now today before. I actually had to Google it. So our topic today is the Finnish Neurological Function Testing Battery for dogs. And it's also called FINFUN. It's a tool for evaluation of functional ability in dogs recovering from functional impairment caused by neurological diseases. And it was developed to meet the increasing demand for objective outcome measures in veterinary physiotherapy. Now, Anna Boström, she is the lead researcher in the development of FINFUN. She joined Anae to discuss this tool and its use in clinical practice. Anna shares how it works, what the benefits have been for her since applying it to clinical practice, and loads more. Before we head over, a quick word from our sponsors. Paul Prosper believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Their brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your pet age gracefully, their brands like the Help 'em Up Harness, FitPaws, Muffin's Halo, and Response System, they all offer effective, innovative, and proven solutions. So you can learn more how Paul Prosper helps pets age gracefully today at paulprosper.com. And you can also see Paul Prosper and their crew and all their brands at this year's Vet Rehab Summit on the 10th and the 11th of November. All right, let's get over to Anae and Anna.
Hi, everyone, and welcome. It's so great to have you with us. Hi, Anna. Thank you for joining us today.
Thank you. So nice to be here. Thank you for this opportunity.
Yeah, I'm very excited to speak to you today. We're going to be speaking about the FINFUN, or the Finnish Neurological Testing Battery, which I'm very excited about because it's going to make life much easier for us in canine practice. Neurological patients are probably the majority of what we see for many of us, and being more objective and more specific with how we're measuring their function is really important. So thank you, Anna, for first developing it and now for joining us so we can all start using your testing battery. So Anna, please, will you introduce yourself? Let us know a little bit more about who you are and why developing the FINFUN was important to you.
Yes, thank you. So I am Anna Boström. I am from Finland, Helsinki. I come from, I live in Helsinki, and I work at the Helsinki University Veterinary Teaching Hospital. I have been working here since 2011. I work with small animals and also equines. Occasionally, we have some other diffuse animal species, goats, llamas, or exotic animals, but mainly cats and dogs, and a lot of neurological cases. And I have also I've done quite a bit of research. I have done a master's degree in veterinary physiotherapy at the Royal Veterinary College, and based on that, I did a PhD at the Faculty of Veterinary Medicine here at Helsinki University, and I had my dissertation in 2018, and that was on epaxial muscles in dachshunds with disc disease. So in a way related to today's topic, but not really. And this FINFUN, so Finnish Neurological Function Testing Battery for Dogs, it was actually, it came much earlier. I started to work at 2005 as an animal physio in a private referral clinic that treated mostly neurological dogs in Finland. It was the first clinic in Finland that would go into a business like this, and they would have an acute, they would take acute cases 24/7. And in a very short time, they had a lot of cases. And because from all over Finland, people would bring their paralyzed dogs to them because they would get the help at once. And I started to work there, and there I realized that we are doing physiotherapy with these dogs, and we think we are making a difference, or of course we know we make a difference. And then I thought that, well, we should do a study to see what are the effects of physiotherapy. So I went to my employer and mentor, Dr. Sigita Sicinauskas, that is a diplomate in veterinary neurology. And I said to him that we should make a study on the effects of physiotherapy. And he said, good idea, Anna. How did you plan to measure it? And then I thought that, well, I didn't think about that. And so he said, well, then you first have to make the measure. And that was the start of the initiation of the FINFUN.
Okay. No, I love that. I love that. Well, how are you going to measure that? I think we don't ask ourselves that question enough. How are we actually measuring this? We're just like, oh, he's doing so much better. Yeah, he probably is, but we're not, we're just seeing it. We're not measuring it. That's we can't effectively communicate to other members of the team. Let's ring up the vets and say, yes, he's doing better. For a lot of vets, that's enough, but sometimes we need more than that. And the same working within a team of colleagues. If we're working with a hydrotherapist or with a trainer or whoever that other team member might be, it's so good to have something we can all use as a way to measure the function of the patient, because that's what it comes down to, the function of the patient. All right, so what exactly is the FINFUN? Just talk us through what this is, what it looks like.
Yes, so the FINFUN, it is a functional testing battery. It's composed of 11 different items or tasks, motor function tasks that are normal in normal activities of daily living for any dog in the home environment, independently of is it an obedience dog, a hunter, or just a sofa potato? And it is a test that is objective measure that has been statistically tested to have a good intra and inter-rater reliability, meaning that it is consistent when several people look at the same dog, and when the people look at the same dog and the same situation with but for, let's say, at two different occasions. So yeah, and perhaps would it be possible, Anne, to share this?
Yes.
This testing criteria.
Yeah, let's pull it up and we can discuss it. All right, Anna, please tell us a little bit what we're looking at here, and how we would use this in practice, because I think that is what it comes down to, is how do we actually bring this into our own clinical practice and use it on a day-to-day basis.
Yeah, so we'll just go briefly through this Finnish neurological function testing battery for dogs, the FINFUN. And actually, here I have to thank my colleague Heli Hytiäinen because she was the one that came up with the name, the FINFUN, because this Finnish neurological function testing battery for dogs, I mean, it will kill you if you have to say this all the time. You need something catchy. And this is very Finnish, and this is very fun. And fun is like a shortcut to function. So there she came up with FINFUN.
I think it is a brilliant name for the test. Brilliant.
Yeah. So attached to the article, which every one of you can find online, it's published open access. So anyone can download, find it and download it. But then when you scroll down in the full text, you will come to this additional file. Please don't scroll down yet. Yes? Sorry. Yes, and there you will find a description of the functional test, what it is. And then we have the definitions for terminology, what we use. So we have shortly described that what is support, what is strong support, and what is light support. Because defining this, if you use strong support, if you have to use strong support during sitting, for example, for the dog, or during standing up from sitting, then you will, then the dog will get less points, lower scores than if you would use light supports, or the dog would be able to do the task independently. Then it is always a matter of motivation. Is the motivation, the ones that have worked with neurological cases, you know that sometimes you need to motivate this paralyzed dachshund really hard with the right treat or the right thing. Otherwise, they will do nothing. So it's often a question of motivation. So we advise that use the motivation to allow for best possible performance. And we also define what sort of motivation could be used. Then we define what is voluntary movements, because voluntary movements is also mentioned repeatedly in the testing criteria. Then we have the definition of weight bearing of limbs, and this is defined as all joints in functional weight bearing position during a minimum of 2 steps. And this is similar definition what has been used also in previously published gait scores, for example. Then we define mistakes: falling, cross-stepping, sidestepping, dragging paws, for example. And these are things that will decrease the score. And ataxia, lack of coordination. And this is also something that if we may have a really good, let's say we will have a really good overall motor function of a dog, the dog may be able to even run or do stairs without any problem, but it will still be very ataxic. Then we had the tricky part, defining movement dysfunction or ataxia, or is it the same thing? And so this is, I think, the decision the clinical researcher has to make. And this was not an easy line to draw, because we all know that we might have the paralyzed dog that, or the neurologically impaired dog that is anyway lame. or have something else that is not really clear what it is, but something still it's not normal, let's say. So this would cover those. And the compensatory movements. This is, I think, the physios, one of the physios like compensatory movements. This is our thing. Vets perhaps don't understand it or why we think that it is important. So, but we have those also. Then we have weakness and stress, and these are all to let's say aid the observer in using the testing criteria to decide which score to use. So just please then again scroll down. Then we have general instructions for the assessor. And this is, the test was developed in clinical practice for clinical practitioners. So you should be able to do this test with neurologically impaired dogs in the clinic or at the house call or in a research project. But in the context, you should try to be as standardized as possible. And these are the instructions for that. So for example, that you need to use the same area and the same equipment and the same handler preferably, and so on. So then we can again go down to the test criteria, and if you would stop there just for a short while. So this test includes 11 tasks. Lying sternally, standing up from lying, sitting, standing up from sitting, standing, proprioceptive positioning, start to walk from standing, walking, running, walking turns, and walking stairs. And it's the difficulty of the tasks is progressive, so that it will get more and more difficult, but you will start with the tasks that you would assume that they're also very severely impaired dog or severely paralyzed dog would be able to get some scores from. So if we would look at this standing up from sitting, just to give you an idea how you would choose the scoring. So then we will have like a short description of each task, like here in this standing up from sitting. So we have the dog sitting on a floor surface in balanced position, weight symmetrically distributed on both hind limbs. And the dog moves with symmetrical thrust with both hind limbs into balancing standing position and is able to maintain this position. And this would be what we would want to see in the normal dog or in the near normal dog. Then comes paralysis, and then we have something else. So the dog will get a 0 if the dog is not able to stand up from sitting at all. You ask it, you have it with a treat, the owner asks it to stand up, you open the door so it is allowed to run out from the stressing physiotherapy session. You do everything you can to get it to stand up. It cannot, so then it gets a 0. If you support it like with a harness or you assist it and it is able to take some weight on the hind limbs, it's able to get up, but you need to hold on to the dog at all times, then it is strongly supported and the dog will get score 1. So if the dog stands up from sitting and it's able to maintain the position lightly supported, here the dog has to do something a little bit itself, it gets a 2. If it stands up independently, you don't need to touch the dog at all. You just need to ask it or open the door or the owner calls it. It gets a 3, but it's still not normal. It may have some asymmetric weight bearing. It may have some compensations. It may be weak. So then it gets a 3. And the 4, the dog gets only if it's performing the whole task independently without and able to maintain the position, the standing position for at least 3 seconds. So this is basically the manner in which the scoring goes for each individual task.
Okay. Okay, I really love that. I love that, you know, you've defined all the different areas that we need to look at, and that's you're kind of bringing motivation and support and all of those things that we're encountering on a day-to-day basis that make it difficult to make something objective, because we feel like each dog is different, and we feel like, you know, this patient needs this and this patient needs that. That makes it difficult for us to be objective, right, and specific. So I love that you've brought that in. And I also feel like those kinds of things make creating a scoring system complicated, because then you need to add, you feel like you need to add descriptors, right? Yes, he can stand from sitting, but when we open the door, when we fully support, you have these buts as descriptors. I love that you've incorporated all of those things into the scoring system and made it really clear. I really like it. Thank you, Anna. So let's look at what it actually looks like when we're going to be using this in our practices. And because I mean, we're not going to be sitting with every patient with this full document and going through each criteria, right? We want to have something that's simple that we're going to be using for the patient in front of us.
Yeah. So this is like the scoring sheet, and here we have the different tasks and the place to put the score and the place for comments. And comments would be, I think you should record always what motivation you use and what to make it really usable on clinics now. I'm not anymore putting lying sternally, support used, motivation used. I'm not doing it anymore for every specific task. I'm doing like an overall for this assessment time. So we are assessing with hind limb assistive device, harness, motivation use, owner calling, and that's it. So, and then we will just do the scores. Then I use the comments to put in that, do we have some medications? Has the dog had some medications before? Or if there is anything out of the ordinary, then I would use the comments. Or if you would have to change the motivation or to change the support, then I would use the comments section.
Okay.
And for example, running, walking turns, and walking stairs, these are tasks that would not be allowed even for a dog that had spinal surgery done, let's say a week ago. Then you might want to add that these were done, but just for testing, and the dog is not yet allowed, but it is still able to do it. Or then that these were not done due to surgery restrictions, depending on what your referral vet.
How regularly would you use this to reassess your patients in clinic? Would you just use it kind of at the beginning and at the end of your treatment period?
Actually, I think we have both the patients that come to the hospital, like they stay for the day and then they go home at night. And we have the patients that are in the wards, and then we have them coming just for a visit and then they go home. So if we would do just initially at the initial visit and then at the end, we will lose a lot of information. But also, although I think this is fairly convenient and quick to use when you get a routine of it, I realize that this is anyway somewhat time consuming. Sometimes we do it in the morning and before the dog goes home, just because we see that something happened even during the day. But then I would, let's say, in general, we would do it initially when we see the dog the first time. Then like every week until the dog is walking, and then depending on when the dog is coming for visits, because the point is that we would do this. We would not ask the dog to come in just for a measure. The point is that when you take the dog into your examination room and you take the scoring sheet in your hand and you have the criteria, either you have them in the back of your head because you memorized it, or you have them in your cupboard so you can look it up, or on your computer. So when you look at the dog, like you would do your normal physiotherapy assessment, then you just give some scores.
Yeah, so it doesn't seem like it will take a lot of extra time, because you're probably evaluating all these movements anyway, and using some kind of descriptive terminology to note down what you're seeing. So this should be quicker once you've memorized the scoring system, because then instead of using descriptors, you're just jotting down a number. So I think that's fantastic. So I want to say thank you to this person from Estonia. We actually used FINFUN for a veterinary student final thesis here at the university clinic to evaluate the recovery of 10 Dachshunds after a hemilaminectomy. So Anna, high five. Your FINFUN is being used not only in clinic but in research as well. That's so amazing.
Nice to hear.
That's amazing. It can this research was published in 2018. So I saw this a few months ago, to be honest. I found the research paper by accident, just looking for a topic to cover in a research refresh, and I was super excited, and then I saw it was published in 2018, and I just had this like dropped feeling in my heart, because something of this much value to us in canine practice, and I didn't even know about it. And fair enough, I'm not in full canine practice. I don't know all the latest and everything, but I am looking at research every month, all the time. We have lecturers speaking every month on online pet health, and that was the first time I'd heard of it, and that's sad. So I'm really excited. That's why I wanted to do this Facebook Live. I didn't want to just share the FINFUN with you guys in a research refresh, because we need to get it out there and get it into practice. I'd love to add another point to that thought. 2 years ago at our Vet Rehab Summit, our theme was research meets reality. And the point of that theme was that it can be really difficult to take research results, to take information from research and apply it to clinical practice, and vice versa. For us to take what we're seeing in clinical practice and then bring it towards evidence-based, bring it to something we can publish, right? And that the main reason why it's difficult for us to take what we're doing in practice and publish it as evidence is that we're not using objective measures to document what we're seeing. So even the simplest edition of a clinical metrology instrument like the Canine Brief Pain Inventory or the FINFUN can allow us to do retrospective studies with our data and compare it to what someone else is doing in their practice somewhere else in the world, because they're using the same objective measure. And to me, that's really exciting. What a massive difference we could make to our profession and our industry if we were using the same objective measures correctly, so that we could look at we could do some retrospective studies and we could compare our clinical findings between patients, between practices, between practitioners, and see something valuable from that. So to me, that's what I'm thinking about, and that's what I get really excited about when I see something like this, because its clinical value is huge and its research value is massive if we just all implement it in our practices and then decide to do something with that information. So Anna, thank you. Thank you.
Yeah, but yeah. I am really happy that you taking this on and giving me this opportunity. And as I told you before we went live, that this you put a lot of effort and work, blood, sweat, and tears into these research projects, and then when they are like out in the paper, you just want to move on, and then actually you should do a lot of work still just marketing it and telling about it to people. And this was the pilot study from this project was presented at the IAVRPT meeting in Minnesota in 2008.
It's easy to forget. Yeah. No, so I definitely, if you guys know of anything else like this that we should all know about, we should all be implementing in our practice, let us know, because I completely get that if you're doing the research and you're working, it is difficult to get that information out to people once it's published. You just want to move on. I completely understand. So that's where we can help. We can help get the information out there, either through lectures and webinars, or through discussions on the research paper, Facebook Lives, whatever it takes, so that we can let people know what is happening and what they need to bring into their practices. So Anna, do you think that every canine rehab therapist who treats neurological dogs should be using this scoring system?
Well, I hope so. I think we all should use some sort of scoring system or consistent writing. I mean, I understand that we have a huge arsenal of different objective outcome measures already that are available to anyone. You don't need a lot of equipment of facilities to use those, but if you use them on every patient, you will drown in them. So I understand the time constraints, but we should aim to use them much more. Definitely. And there, I think the FINFUN actually, I think it is useful. And I think it's used in several ways. But there is a but. You need to train to use it. You need to practice to use it. You need to really learn the criteria for it to be so that you feel confident when you choose the criteria. And when we developed the testing battery, we had a pilot study, and then we had this actual study, and we used these volunteer observers, and we have these critical reflections with them, and they had training, and we evaluated or discussed that how did they experience the scoring and so on. Some 8 patients, they felt they needed to score before they felt that they could do it properly. So it needs practice, and also research on other gait scores and functional scores claim that you should practice. Of course, with any tool you use, you need to learn how to use it. But then when you know how to use it, and you feel confident, it is quick to use when you do it within your normal physiotherapy assessment. And currently, we actually use, in our physiotherapy team, we use very much the terminology from the FINFUN to describe what we see. So we write, for example, non-ambulatory paraparesis, voluntary movements in both hand limbs, more on right, able to walk for 10 meters with strong support, blah, 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 blah. So also our documentation for the neurological cases, when we describe their functional ability, is based on this criteria. So I think this helps also, even if you would not take on the scoring, although then the scoring is the number you can compare to really compare then And also the FINFUN was developed and it's statistically tested, so you can use the whole, like the sum score for the whole testing battery, or you can use it only for like each individual task. So you can also, in terms of time or in terms of what the dog is able or allowed to use, you can choose the specific tasks that you will use as your outcome measures for this particular
Yeah,
patient.
that's very helpful, because as you say, you're not sometimes, right after surgery, you're not going to be looking at some of those more advanced movements or functional activities. So having them in the score is a disadvantage to the to the overall. So okay, I really like that. You can use just a portion or the whole thing and then compare over time. What do you think has been the biggest change that you've seen in your practice and in how you're working with these dogs and communicating with the rehab team or the veterinary team since you've started using the FINFUN?
I feel that the documentation is easier. I can rely on that when my team members is describing, when I read what my team members have written about this particular patient, I see it in my head how it moves. And our neurologist says that, okay, when I read your text, I know what it looks like. And also when we have clients coming from this referral clinic and we write them feedbacks, then they know what we are saying. So it has really helped in this communication within the team and also with referral vets.
Yeah.
And this, I have found this being the most helpful thing, really.
Okay. Did you do some training with your referral vets to show them how the scoring system works? Have they adopted using the scoring system, or are you kind of translating the results when you're sending them a report or discussing a case with them?
With our referral clinic, they were the ones that were with us developing it back in the days. But of course, they have new people working, so we have presented it. We have presented this test, but they are not using it themselves. And here at our clinic, we have also presented the test, but we are the ones then using it because we are doing like the physio evaluation and then they do the neuro exam.
Okay.
Which I think, if I might add, that the neuro exam done by the neurologist and the functional evaluation made by the physio, they are like not competing with each other, but they are like complement each other. Yeah.
Yes.
And it's also some of these other scores that are available, they include quite a lot of diagnostic testing.
Yes.
Which is of course also good, but it's not. But then it is difficult for a physio with not veterinary background to take on a test like that and use it.
Yes, and I don't think we have really evaluated the reliability of. I'm not sure honestly, but of some of those neurological tests and how reliable is that and how comparable is it when I'm performing that test versus the neurosurgeon, because I'm going to guess not so much. I can definitely sometimes not do the reflex tests and get the results that I think I should be getting. And they're like, well, maybe I'm going to just disregard this one. So I think that's an important consideration. And that gives us another opportunity for connection with our referral vets, because if I think about that and we're using this testing system or the scoring system that they're not familiar with, it gives us an opportunity to say, okay, hey, I'm using this tool. Let's set up it's called all different things all over the world, but like a lunch and learn or a little free lecture or some kind of event where you present the information to them and you share the information with them. And it gives you the opportunity to just open that discussion and build those relationships with your referral vets. And to me, any opportunity that we can use to do that is a good opportunity, especially when we're saying, like, we're going to be more objective, more specific, we're going to up our game. I want you to know that I'm upping my game. This is how I'm doing it. I think that's brilliant. That's really exciting. If you would like to use the FINFUN and you're an Online Pet Health member, we've made it very easy for you, because it is this month's Research Refresh, the article where Anna and her team looked at whether this is an objective scoring tool or not. So that article is our Research Refresh. It's an open access article, so it's attached underneath the recording in your members portal, and so is the actual test, the Word document that they created. So you can get both those resources in your members portal together with the Research Refresh. And if they want to do further training on using this, how do you recommend people do that? Is it enough for them to take the scoring system that you've created and then look at some video footage and practice through the use of video footage, or do they need to do more than that?
Well, I think that it could be good to use video footage as it is described in the article, just because then this could then be something that also new team members then also always could use these same cases. But then definitely also should practice on live dogs. And basically, I would say that also do it together with a team member, or or if you work alone, get together with colleagues close to you. So you together, you practice and you discuss, and you practice and you discuss, and then make sure I would practice on some 8-10 patients.
Okay, I like that idea. So get a group together of maybe 5 to 10 practitioners. You each come with 1 or 2 cases, videoed cases that you're going to score. Sit and score them together. Compare your, not together, score it on individually, and then compare your results with each other. Discuss and practice like that. I really like that idea. That's a very good way to do it. Thank you, Anna. Yeah. And again, another opportunity for us to get together and up our game. I love that.
And definitely, if you're interested in having some really like practical, educational short thing, how to use the FINFUN with some scoring videos or something, then this is definitely something that we could plan if you would like.
So guys, to wrap up, I just want to remind you that the Vet Rehab Summit is on the 10th and the 11th of November. If you haven't saved the date yet, you need to do that, please, because it will be a live event. You need to be there, and that's not negotiable. So please, guys, the 10th and 11th of November, you want to be there. We're going to be speaking about myofascial chains with Vika Albornt and Rika Schultz. And they're going to be covering canine and equine. And I'm extremely excited about the canine component, because we just don't talk about the fascial chains enough in dogs. So I cannot wait to learn about that, and to learn how they work, what they look like, how we can influence them, how they're being impacted in our patients. A lot of the Vet Rehab Summit is going to be looking at cases. So I think that's going to be really exciting. Keep a lookout, because we'll be sharing more information in the weeks to come. If you're an Online Pet Health member, you get to register for free. Not only do you get to register for free, you also get VIP access, which means we give you a little something special at the Vet Rehab Summit. So keep that in mind. If you guys are not members and you've been thinking about it, that's an entire free Vet Rehab Summit. It's definitely worthwhile. Anna, thank you so much for your time today. I've really enjoyed chatting to you. I'm very excited about the FINFUN. Very excited to see what else you guys come out with. I know Haley is doing some work. And yeah, thank you.
Yes, thank you. This was really nice to be here. Thanks.
Thanks, guys. Bye.
Yes, thank you. Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paul Prosper. Their sponsorship allows us to be able to give this podcast to you for free. Please go and check them out. You can go to paulprosper.com. Don't forget to bookmark the next Vet Rehab Summit. It's on Friday the 10th and Saturday the 11th of November. Come and be a part of the world's largest online veterinary rehabilitation conference. It's created specifically for you, the vet rehabber community. Onlinepethealth members, you get VIP complimentary access to the Vet Rehab Summit. For more information and continued education for vet rehabbers, you can go to onlinepethealth.com.